In the first video, I shared how the FOD group was founded and how we offer families emotional support and information on living with these disorders. In this video, I briefly share how FODs present and how they're diagnosed and treated. Be aware that each person's FOD treatment should be individualized according to their own needs and presentations, and no changes should be made without consultation with your medical professionals. So what is a fatty oxidation disorder? Even though MCAD was discovered approximately 25 years ago and some of the other FODs in the early 90s, there are many that still have never heard of these silent disorders. They are silent because the kids and adults look so normal, yet very quickly they can go from being very active to comatose to possibly death if they are not diagnosed and treated, or the emergency protocol is not followed immediately, or it's totally dismissed, which has happened with several of our families over the years. FODs are rare genetic metabolic disorders in which the body is unable to break down fatty acids to make energy because an enzyme is either missing or not working correctly. So when you are out of carbohydrates, it's like the gas tank is empty. The body's running on fumes. You're trying to break down fats, but because the body can't completely, toxins build up and can cause life-threatening problems if they go untreated. So these are energy metabolism disorders that fall under a larger umbrella called mitochondrial disorders, which you've probably heard about in the news recently in regard to diseases such as Parkinson's and Alzheimer's. FODs affect both males and females. Both parents are carriers of an abnormal gene, and when two abnormal genes unite, the child will have an FOD. Each child would have a 25% chance of having an FOD and a 75% chance of either being just a carrier or not having the abnormal gene at all. If one child is diagnosed, their siblings should also be tested, even if they are asymptomatic. We also have parents being diagnosed with FODs, especially after a newborn has been diagnosed. They may have had various symptoms all their lives, like low blood sugar, hypoglycemia, or muscle aches or chronic infections, and often passed off as growing pains, fibromyalgia, or all in your head, which we've all heard at one time or another. But now they have an answer for those symptoms, symptoms which can be managed by proper treatment. Mitochondrial fat oxidation disorders may present clinically with hypoketotic hypoglycemia, low blood sugar with trace to no ketones, heart issues like cardiomyopathy, and muscle myopathy. One can present with just one of these presentations or a combination of them. Some may think if one produces ketones, you can automatically rule out FODs. That is not always the case, however. We do have some individuals that produce ketones, but most have trace to none. There's a wide variation in presentation, even within the same family. Not every person responds to a disorder in the same way. Some may be without major symptoms, yet others may have chronic bouts of low blood sugar, leading to many hospitalizations, especially during the first years of life. But please note that hypoglycemia is not always present when someone is in metabolic crisis. It is our mission to make all aware of these types of disorders so medical professionals will think outside the box when someone comes into the ER, maybe looking lethargic even though their blood sugar may look normal. For those with an FOD, even a blood sugar of 70, one can be in crisis. Or maybe one has chronic infections, low muscle tone, possible seizures, vomiting problems, developmental delays, autistic spectrum features, ADD, high ammonia and liver enzyme and organic acid levels, problems with heat and or cold. These are just a few of the presentations one can have, especially when undiagnosed and untreated. We have many families like ours that have experienced either a death or have a child that has severe medical problems because they weren't diagnosed and treated early, and they had severe episodes of fasting, vomiting, or diarrhea, high CK levels, rhabdomyolysis, which occurs with many of the long-chain disorders, and then they didn't get what their bodies needed, which is sugar or dextrose. And that's why knowing you have one of these disorders is so important. Most ERs only give saline IV to avoid dehydration. That's not enough to save someone with an FOD that's in crisis. They need at least a 10% dextrose IV and immediately, not 6 hours later. And professionals need to know this is not diabetes. The treatment is not the same. The main point is that knowing you have an FOD is vital for a child or adult to live their lives and be able to pursue whatever they choose to do. One can live a full life with an FOD if it's diagnosed and treated. FODs are diagnosed in a variety of ways at specialized labs across the country and the world. Some of those labs are listed on the FODsupport.org website on our medical information page. Blood, urine, skin fibroblasts, amniocytes from amniotic fluid, and muscle and liver tissue are some of the specimens analyzed. The diagnostic tests often include an acylcarnitine profile, urine organic acid analysis, carnitine levels, and enzyme assays in fibroblasts. Many times the best time to take these specimens is when one is sick or in crisis. Some have even gone through a supervised fasting test in the hospital. The acylcarnitine profile with whole blood on a filtered paper card, like a newborn screen card, is the most direct approach for diagnosis of most of the FODs, but it sometimes is not enough to get a diagnosis. Some families follow up with either a skin biopsy or a muscle biopsy, especially if all the other tests look inconclusive or didn't look like what the diagnosticians usually see. With new mutations being discovered for the various FODs, lab results may look different than other common mutations, so don't stop just because the acylcarnitine profile looks normal, especially if your child or you are symptomatic. Definitely discuss the skin or muscle biopsy with your doctors. We do have some families that fall under that unclassified FOD category because their results don't fit the usual findings of the already identified or named FODs. Keep in mind that the expanded newborn screen test is just that, a screening. It's a red flag for a possible disorder. If you get a positive screen, then they'll do further testing to determine if there's an actual FOD involved. Every now and then there are false positives, however, so the expanded newborn screen is not a 100% definitive test. Again, note that when the blood is taken when one is well, the results may come back looking normal, so it might yield more accurate results if the blood or urine is taken when one is not feeling well. Treatment for FODs is multidimensional. A major concern is to avoid fasting. For older children and adults, that means going without food or calories for beyond 8 to 12 hours, such as an overnight sleep, when well. However, for infants under 6 to 8 months or so, they should be fed around the clock every 2 to 4 hours. Most children and adults with an FOD graze all day and eat every 3 to 6 hours during the day, and the interval depends on various factors, such as if they are ill versus well, in which case they would eat or drink more often around the clock. Fasting times can vary from person to person within the different disorders. A fasting state, especially while ill, can trigger a metabolic crisis, leading to lethargy and hospitalization. Several snacks and meals of low-fat, high-carb foods such as cereal, pasta, and other complex carbohydrates, as well as sugar drinks when not well, are recommended throughout the day. Some families also use various supplements like riboflavin, CoQ10, cornstarch, MCT oil, or C7 oil, which are not used for all the FODs. And also with GA2, one needs to watch the amount of protein in the diet along with the fat. Some physicians prescribe the FDA-approved drug Carnitor for several FODs, especially if carnitine deficiency is a secondary disorder. There is also the generic drug levocarnitine. They both come in liquid, tablets, and for IV use. Carnitine helps get toxins out of the body and helps with muscle tone. Be aware, however, that the health food store carnitine is not regulated and not recommended for patients with metabolic disorders. And if one is having surgery, avoid fat binding or producing anesthetics, lactated ringers, long-term use of steroids, and products that contain aspirin or salicylates. These can cause possible complications. We have some anesthesia information and links on our medical information page below the description of the disorders. We also have examples of emergency protocols on our site, but that should be written in conjunction with you and your specialist. It is vital to have that emergency protocol ready before you end up in an emergency situation. So the key is first getting a diagnosis, whether it's after newborn screening or for those that didn't have screening available, after months or years of doctor visits. Do not give up, especially if they tell you it's all in your head or it's just the flu. Of course, it may not be an FOD since there are hundreds of metabolic and mitochondrial disorders. But if you or your child are symptomatic, do not give up your search. This has been a brief summary of FOD diagnosis and treatment, but for more information, please take a look at FODsupport.org. In the next video, I will discuss some of the concerns our families have while living with these disorders. Again, thank you for listening, and send me an email or call if you have any questions. I am not a medical person, so I can't give medical advice, but I'll try my best to answer what I can. Thank you again, and take care.